Okay, thank you. Well, first of all, I like so very much all the presentation I have here. I take some notes about, especially about the environmental, about as we were working about. We started to study about cell plasticity 10 years, 11 years ago, and we were working. About to epoch. Uh, and well, when COVID-19 emerged, and we make the test about it, and that's the presentation that we're going to do. This research was published uh, by microbial pathogenesis in Elsevier, uh, but uh, some journals like PubMed and CBA almost has published these results. Uh, well, I try to be brief. I'm gonna say some things that is very identified just for the clearing what we working. It has shown to have a mutation capacity superior to its predecessors. It have a lot of sequences of COVID-19. This have a lot of mutation, and it is difficult to have a specific treatment. I am agree with Dr. Facal is the cell therapy. We share the position as the best option about. Its infection process is okay. Everybody knows about the ACA2 genetic code. Then it could be a multi-organic disease, not only brief, it could be in cardiac, kidney, neuronal system, etc. Yes, a lot of problems that could be caused this virus. The characteristic of the people can strongly influence in favoring, say, the poly incubation. Uh, Even the World Health Organization said in the persistent COVID, it had more than 200 symptoms because it could be in any tissues and it could be very difficult to follow, even when the people, with the person, recover from COVID-19. The first SARS-CoV-2 genome was reported in January 13, and in September, we had more than 126,000 genomes worldwide. By May 2021, it was reported more than 1,200,000 COVID-19 genomes in these data banks. There is a lot of option, mutation. It is difficult from attack because it evolves very fast. That's what we consider the cell therapy. It could be the best option for it. This is something that we have doing since 2010, a topical treatment for ulcerative diabetic foot. This is about plasticity cell. We were working about the PTLL tissue, and we work in some way that stop uh, the the blood and control the infection. After that, we developed a fractional system from extracts. This was important time to time because we can take the antioxidant and the inflammatory parts of some extract in herbal essence. In 2014, we worked in neurotransmission assay. I guess in 2000, the Nobel Prize was about this. We were studying, and we were working with a mosquito for send in about his neuroreceptors, send some information, and we were capable that, for example, the female doesn't ovipositionate in the other program about his neuroreceptors. In 2016, we studied the neurosystem in the vegetables. All the plants have an immune system. Some simple, but it it shows some important about the adaptive immunology system, how could with the can involve for expelled some pathogens or not organics. Uh, it was important in our research. In 2019, we developed the KIOP treatment, so this brief treatment, and when we were able to pass to human process, the SARS-CoV-2 emerged, and we make the testing in the COVID-19. Well, we were used two kinds of plants, fractionate and two organic solvents. In this part of the world, we come from Mexico. In all Latin America, we have a pre-Hispanic tribes have a medicinal use of one of them, Asclepias curasabica. There is some of the studies in Latin America we have about the let's say the Network Scientific Journals of Latin America, the Caribbean, Spanish, Portugal, the scientist Carter Gustavo in his research entitled Medical Ethnobotany of Indigenous Growth and its Comparison with that of Creoles of Semi-Arid Chaco in Argentina. Indicates the use of Asclepias infusion of its aerial parts to treat pulmonary affection and sometimes against cardiac pains. For example, in 2007, Miriam Plasti from Uruguay published the summary compendium of the use of Asclepias curasabica as a traditional plant throughout Latin America. In 2020, Martinez G. Vanessa from Santo Tomás Manizales, Colombia, the evaluation of ethnobotany of medical plants used for respiratory disease in the department of Caldas. The UNAM in Mexico published it was prescribed in some respiratory elements such as constipated catarrh and chronic catarrh to decongest the nose and throat. And like this, a lot of research, some in India, they are studied this plant, the Asclepias curasabica, and a lot of studies about. We were studying this, and what is the part of these plants that it could be useful for these expeditions. Taking into account the above and the wealth of plants in the Mexican Republic, we proceed to look for plants that could have the best capacity to help control the symptoms caused by the SARS-CoV-2 virus, in addition to standardizing a protocol to obtain the extracts. Then we obtain the extract. We can see this, the Nigeria. This is the Asclepias. We part of this, as Dr. Basiskowska said, the antioxidant and inflammatory capacity of the extract of these plants can help us to control the harmful effects of the COVID-19 as preventive in the disease, and even when the people recover from COVID-19 and have fibrosis, for example, it could help you to recover the capacity pulmonary and so. The properties of species, the Asclepias curasabica in particular, are sneezing, febrile, and expectorant, allowing to cure a constipated cold and sneezing the panty, reducing fever, and, as we know, reduce inflammatory of the pleura. Even in some parts in US, the American natives knows this kind of plants, the root, as pleurisy root, because they use it too for inflammation of the pleuras. As you can see, these plants have a great capacity to modify structures, since it presents some compounds such as cardiotonic, glycosides, cardinolase, and various types of alkaloids derived from 2-methoxypyroxene, between other kinds of phytochemics that it could be useful for the treatment of Uh, in general, the other brief treatments like COVID-19, it could help us even in some cardiac troubles. The other plant, the Naegeli sativa, had been reported to be used in Egyptian folk medicine as diuretic and carnitative. Uh, some extract of this seed is in concentration from 1,000 to 62.5 parts per million was found to have the same activity as juvenile growth regulatory hormone. The extract obtained from this seeds of Naegeli sativa has an anti-inflammatory and anti-cancer effect both in vivo and in vitro. This was a research by Kumara and Hot in 2001, Salome et al. In 1992, between other students about. Then we combine the extract of these two plants between ethanolic and propylene glycol, and we use it by intranasal. That's because in the nose we have the most sensitive neuroreceptors. The integration of the elements of the treatment of the symptoms produced in a particular case in disease caused by damage on endothelial cells, such this caused by SARS-CoV-2 virus, in other diseases where the proteins that are affected have been carried out, make up endothelial cells through a concentration of apodictus that combine extract of Naegeli sativa and Sclepsia sabica as well as the solvents that balance these extracts. There are propylene glycol and ethanol to modify proteins to avoid extreme damage to the endothelial cells at the concentration that is effective in decreasing the symptoms present in a patient. We start making some proofs in grenadine and other kind of proteins for the pictures in the microscope and see the modification of this protein, especially in the endothelial tissues. And after that, we were combining with the exercises to use the neurotransmission system for send the signals. Then at the in the L, in the terminal, it produces a biochemical reaction in the same function of the stimulation. Then we can find that, for example, in a patient with COVID-19, it have an SpO2, for example, of 85. We apply this product, and in less than 2 minutes, the patient have more than 90% in the SpO2. That is not that in 2 minutes the people recover the health. This is just an impulse to work in the microenvironmental cell. And with these microenvironmental cells, also the immunity system and the cell start to recover his function. There is. Here, the alveoli, the alveoli wall, they are flow. This is normal. This is the lasted fever. Have elasticity. This is elastin. What happened when it was attacked with the virus of COVID-19? If comes to break the wall and loss of elasticity, then the airflow is down. The SpO2 reduced. When we put this, we the first stimulate the activate of the wall and recover the capacity of flexibility of this. Then in the first application, in the most of the cases, we can elevate this SpO2 increase to up to 90, up to 90%. 15 minutes, 1 hour, 5 hours, 10 hours, 20 hours, this down again. But we put the solution and increase again, and every time the position of be up to 90% is more continuous until the people recover the health. The reason to use via intranasal administration is ordered to affect the estrogen receptor. and it has been shown that is mean in the related problem infection and not infection neuropathologies. Our study population were in 600 individuals, divided into 6 groups. The group 1, 100 patients confirmed with COVID-19 through laboratory testing. Group 2, it was around 100 patients with symptoms, high fever, loss of smell, an appetite, diarrhea, phlegm, coughs, etc. But no confirmed on positives because we have not enough tests belonging from the health sector. Then it was just the diagnosis of the doctor, the medical. Group 3, healthy individuals without symptoms but high risk of contagion. They have belonged to the public health sector. There are nursery, doctors, people who have taken care of the sick people, or in the first 10 months of the pandemic, it has, in Mexico, it had a very difficult the situation. The hospital cannot give attention to all the people. A lot of people with COVID-19 is having their homes, and some particular medicals have to visit, and there was some kind of difficult. Well, this 99% was in high risk. 10 people, individuals in high risk of contagion in their family or neighbor circles. There was at least one patient confirmed with COVID-19. 100 people, risk individuals with chronic respiratory disease like asthma, rhinitis, sinusitis, bronchitis, smoker, or other situation. And 101 individuals with low risk contagion. They are healthy, they are disease-free, they have take cares, they are in their home, and this is the universe that we use for this study. The ABM SPSS statistics is what you use it for perform inter-observer agreement analysis using Cohen-Kappa. Well, here in table 1, the symptom with disgraces present related to COVID-19 and the percentage present in group 1 and 2. High fever with values more than 40 degrees centigrade in group 1, 100%, in group 2, 89. Troubles breathing, group 1, 100%, group 2, 70%. Headache, group 1, 100%, group 2, 90%. This is the people, this is confirmed with tests, this is diagnosis by the doctors. Dry cough attacks, anosmia, asthenia, abscessia, triop, diarrhea. This is the people with the symptoms. In table 2, we have the percentage of individuals and reaction present in each group instead of placing nasal drops. The nasal is drops in intranasal is the signal, just the signal, and the neurotransmission system send the signal to all the terminals. The symptoms, burning nose. This is a big problem for around the 10-20 seconds. It have a burning nose to 85%, 79, 81. This is the percentage of people to refer a burning nose, the most of the people. Tearing, some of them report tearing, running off, coughs. What have with this? Cough with phlegm or dry. As we are stimulated to expel it, we involve the virus and expel it, then it produces cough and phlegms. The people start to sneeze, to cough, to expel it, the viruses. Then we have no problem with the mutation in the protein S because we are not decodifying this code. Then if it's mutation, we have no problem because we are involving, and if the alpha the beta, the delta, etc., we involve and expel it. The 100% of individuals with both confirmed and unconfirmed COVID-19 symptoms initiated to placement of nasal drops between 4 and 17 days after this first confirmation began. 12 of the individuals initiated the drop hospitalization or when leaving the hospital, in figure 2 appears, the percentage of all individuals with symptoms related with COVID-19. There are the group 1 and group 2 of the study, and their status during the study is observed. Of the numbers of hospitalized, 12 individuals are hospitalized when we started the application. And this is how they were configured. In the case of 10 hospitalized individuals, they were invasive mechanic ventilation, with 8 are men, 3 are women, were applying nasal during their hospitalization, and 2 for men began post-hospitalization application. They were the profile. What happened? The 8 individuals who were applied nasal in the hospital had acute respiratory distress syndrome, in addition to having onset of chronic obstructive pulmonary disease, having SpO2 even less than 40%. At the time of nasal, all the 8 patients no longer required mechanical ventilation for the first intake. They increased the SpO2, and even one of the 3 women refers their ventilation with me removed at the minute of the application of the droplets. Since the first application, they say, I don't need the ventilation. All patients were discharged without any complication, having SpO2 values greater than 90%. Group 3 to 6, regardless of the 3 individual, was indicated that they started with the presence of symptoms, or all forms without the presence of symptoms of discomfort. The reaction caused by nasal in all individuals in which they occur lasts no longer than a few seconds. There was at the most 20 seconds in the case of Furning and Turing. After that, they have no problem about. A couple of minutes of nasal flow, sneeze, in a burst and coughed. It depends, even when we apply this with people who have in a very dry position, they have a lot of dust, even they are not with a disease, we apply nasal and they start to sneeze because all of this dust, the immunity system detects like something that have to be expelled and start to sneeze and cough to expel it. And of this discomfort of the head, either pain of the sneeze, about 5 to 10 minutes. This because the SpO2 could increase, and so people refer a little pain for this minute. Of the 2 patients who were with invasive mechanical assistance, but were not given 2 drops during their hospitalization, but after it, they spent 17 days in the hospital, being 2 males individuals, aged 38 and 57. The individual aged 38 has no harm. However, he was discharged with oxygen assistance and recurrent extreme weakness and dry coughs that prevent rest. At the time of the use of the soil, to help the oxygen by mask. Problems with abundant nasal phloems, with withdrawals, which allow him to improve his breathing, and the recurrent dry coughs disappear. The patient aged 57 years was discharged with a pulmonary microthrombosis and cerebral hypoxia, maintaining SpO2 values less than 19 extreme dryness that prevent him from walking and even sitting in the bed itself. It had a very problem to him. At the time to use Nasol did not require the help of oxygen by mask. His oxidation in blood increased to 96%. Tiredness and constant cough remained. 67 years, the man, the first to be hospitalized, was the man to apply the drug, only for 4 days before being hospitalized. The reason by the application was the presence of flu symptoms. He stopped using them and was subsequently hospitalized. In his hospitalization did not require invasive mechanical ventilation, and during the 4 days of his hospital was given the soil only one occasion. And the time of its transfers to another hospital confirmed that he had COVID-19, and due the protocols available to the public health sector could not apply the drops. This was an experimental treatment. At the time of stopping using them, the SpO2 was under 17. However, it did not require assisted ventilation. Once outside the hospital, returned the application. This because the family asked for use it, maintaining an SpO2 between 92 and 96, expulsion of phlegm and abundant nasal flow, improving the breathing capacity and complementary eliminating fever and general discomfort. This is interesting because this person, he stopped using them, the symptoms increased, and they started to using again, and the symptoms were disappearing, and the SpO2, the breathing, was increasing. Well, this was what we published, the use of nasal intranasal to control the harmful effects of COVID-19. After that, we can start to work with a network of private doctors, private medicals, to use in different people. And we have a communication with them through a coordinator. Between September 2020 and August 2021, we have a compilation of their results, looking for some other results. And we find this is not in the research. These are a new result after the research. The total, they were approx 10,000 people. 50% are male and 50% are female. By age, 22% are 29 and younger. Close to 60% are between 30 and 59, and 80% are 60 and older. Purpose of the application: as preventive, almost 80%. And COVID-19 patients, 20%. This is the profile of the people and why they use it. Okay, regarding hypertension, with hypertension, 47% say they have hypertension. It has very high, but the people say that. Regarding diabetes, the diabetes is a very high problem in Mexico. With diabetes or predisposition, 61. You have diabetes or your father's a condition. It could be that in any time you can have diabetes. No diabetes or predisposition, just 2%. Have no idea if they have diabetes or predisposition, 36%. Other disease presence at the beginning of the training. With asthma, 1.40%, heart disease, 6.82%, with cancer, 27%, the most of them are for lungs, tuberculosis, 1%, other 6%, on the patient with COVID-19, what happened? If the infection is intercellular, the immune system cannot work to attack the virus. But when we applied this combination, we have antioxidants, anti-inflammatory, then start to expel from the cell, and then the immunitary system can focus to the virus. Then the immunitary system start to work, and when it start to work, it could produce a hit. It what referred to fevers. Then the 75% of the people, of the patient who have infection after the application refers fevers while the treatment, but just for a while, just for a few days. But the rest of the system start to get better. They refer a kind of fevers and start to sneezing, to flames, and other kinds, and the symptoms start to get better. The sensitive disease improvements with applied in the soil since the first days, 27%. Since the first day of application, more than 1/4 of the people say they feel better. In 2 days, 11% less. 3 days, 5.6. 4 days, 33. What happened? If they have a higher level of damage, we use the scale who promote the Royal College London in England in 6th level, and the number 6 is the more damage. Then that's because some of the people start to get better until the 4th, 5th, or 6th day. They are the people who have more problems with the health. The chest pain. In 3 days, the 42% of the people say have no chest pain. In 4 days, another kind similar, and in 5 days, 14%. That's in 5 days, almost all the people who have chest pain said it was eliminated. The fever was eliminated in 3 days for the 30%, in 4 days, 60%, and in 2 weeks, 10%. There is the people who have more damage by COVID-19. The most frequently period to regain the smell is 4 days, but we have people who have like this until 4 months. The most frequent period to regain the taste, 5 days. The most frequent period to recover from muscle pain, 3 days. On the preventive application, improvements are found without prior identification. This was interesting for us. 42.86% of the people who took the treatment as a preventive declare respiratory problems from the start. They say, I am healthy, I have no problem. But out of the health says, oh, well, I have respiratory improvements. And 10% of the people who took preventive treatment with a prior disease identification report improvements in cough and allergies. They say, I'm healthy, but they shouldn't say, oh, I have less cough, I have less problems with my allergies. With the people who have prior identification, 100 of the people with asthma who took preventive treatments declared improvement in the disease of more than 80%. There is around 5 months of use the solution and say, hey, I have a better in asthma around 80%. And the 83% of the people who took preventive treatment with heart disease declared improvement in this disease. They are declared by the patients. There is no measure. Just is referred by around 20 doctors who have the treatment with the people. Another result, a preclinical test of 20 individuals who have been vaccinated and have used nasal with different pros brand. We have talking about Pfizer, Moderna, CanSino, etc., against a control group of 20 people from which a clear difference is observed in the formation of antibodies. Being the control group is a formation between 11.5 units per millimeter to 150. While the individuals who have been vaccinated and have also used nasal increase their antibody formation at levels to more than 250. It produced a better formation of antibodies who had formed by the vaccine. The use of nasal as an adjuvant in the effectiveness of the generation of antibodies. It should be 1 week before vaccinates and 2 weeks after vaccinates. That was the protocol we used. Applying the soil followed in the morning and in the night, apply the drop in each nostril, and in the evening, 5 drops under the tongue or in the throat. That's what that we are using in this. Even we are for publish our research in 4 cases for patients where we were using, they recover from COVID-19, but they have problem of fibrosis in the lungs. We were making a test and they are recovering the pulmonary capacity. They start the exercise. Even we are recollecting more evidence in more patients. For there are people who even they recover for COVID-19, but they need a mask to help the breathe, the respiratory, because they have no enough strong about. We have a train about, and they recover the flexibility. They expelled some the coagulants that they have in there, and they are now without masks. They are recovering the breath respiration. We are using this because the antioxidant capacity, the anti-inflammatory, and we are modifying the structure of the epithelial tissues. Then they reduce the probability of the infection of the COVID-19 through the ASE2. That's what we are making. Thank you for orientation. There are the email. That's where we are doing.